All right, today we're going to do something super practical. We are decoding the medicine cabinet. We're going to explore some of the most common medications out there, talking about what they do, and more importantly, the safety stuff you really need to know. Let's get right into it.
So, does this look familiar? You open a cabinet, and it's just full of boxes and bottles, and maybe a little bit of confusion. It's a really common feeling. But what if just a little bit of knowledge could cut right through all that? Well, that's exactly what we're here to do.
We're going to take a closer look at some of these everyday medications, breaking down what they're for and highlighting some essential safety reminders. Now, look, the whole point here is to build your awareness so you can have smarter, better conversations with your doctor. This is absolutely not a substitute for professional medical advice.
Okay, let's dive right in. First up, we're tackling some of the most frequent reasons we look for medicine in the first place: issues with gut health, managing pain, and that critical need to rehydrate.
First on our list is diclofenac. It's an anti-inflammatory often used for things like pain or muscle spasms. But here's the thing you have to remember. It can be pretty rough on the stomach. That's why if you have any history of ulcers or kidney issues, it's so important to only use this if your doctor says it's okay.
All right, next up, ranitidine, which is for acidity and ulcers. And, this one brings up a really interesting point about medicine around the world. The rules and even whether a drug is available can be completely different depending on what country you're in. It's a great reminder to always check your local health guidelines for the latest info.
Now here we have a combo pack of domperidone and ibuprofen, often for nausea and bloating. And this is a perfect example of a golden rule with meds. Don't just start mixing different types of drugs, like painkillers and anti-nausea meds, without getting professional advice first. It's such a simple rule, but it can prevent some really serious problems.
ORS with zinc. So simple, but so incredibly helpful for rehydration, especially when dealing with diarrhea. But listen, the safety warnings on this one, they are absolutely non-negotiable. If you see red flags like blood in the stool, serious dehydration, or a fever that just won't quit, that's your signal to get medical help right away.
All right, let's switch gears. Section 2, now we're looking at breathing a little easier with some common medications for allergies and asthma.
Okay, loratadine. You probably know this one for seasonal allergies, and its big selling point is that it's usually non-drowsy. But that word usually, that's the one to pay attention to. Everybody's body is different, so it's always smart to see how it affects you personally before you plan on driving across the country.
Then there's levocetirizine, also for cold, cough, and allergy symptoms. But this one, it comes with a bit of a stronger warning. It may cause drowsiness. So that's a clear heads up to be careful if you're doing anything that needs you to be sharp, especially driving.
For anyone with asthma, the salbutamol inhaler is a total lifeline, right? It's for quick relief. But the safety note here is so important for managing your health. Seriously, think of it like a little alarm bell. If you find yourself reaching for your reliever inhaler more and more often, that's a sign that your overall asthma plan might need to be looked at again with your doctor.
Okay, our next section is all about infections. And it gets to one of the most misunderstood and honestly one of the most important ideas in all of medicine.
And here it is, the big one. The difference between bacteria and viruses. Antibiotics are amazing at killing bacteria, but they do absolutely nothing, zero, against viruses, like the ones that give you a common cold or the flu. Taking them for a virus doesn't just not help, it actually contributes to one of the biggest health threats we all face: antibiotic resistance.
So let's see that in action. Ciprofloxacin is a powerful antibiotic prescribed for specific bacterial infections. And as that safety note spells out, you do not use it for a viral cold or flu. This is exactly why it's so critical to get a proper diagnosis from a professional before taking anything.
And another common antibiotic is clarithromycin, which you might see for bacterial respiratory infections. Beyond the only use when prescribed rule, the safety note here points out something else that's key. Check for interactions with any other medications you're taking. Your doctor needs the full picture, so make sure they know every single thing you're taking.
Okay, let's switch it up from bacteria to something different: fungal infections. Clotrimazole cream is a common way to treat them. The advice here is really practical. Keeping the area dry helps it work better. And a good rule of thumb here is, if it's not getting better, it's time to check in with a clinician.
Okay, so we've talked about short-term fixes. Now let's get into the long game, managing chronic conditions. These are the kinds of medicines for things like diabetes or heart issues where consistency is really the name of the game.
So, glimepiride is used for type 2 diabetes, and its safety note is a fantastic example of how medicine and your daily habits are totally connected. This drug can cause low blood sugar, which means something as simple as skipping a meal can become risky. It just shows how your routine and your medicine have to work together.
Next up is losartan for high blood pressure and helping protect the heart. And there are two really important safety notes here. One, you've got to monitor your blood pressure regularly to make sure it's doing its job. And two, for anyone who is or might become pregnant, talking about its safety with your clinician is an absolutely essential conversation to have.
All right, rosuvastatin. This is one of those statin drugs you hear about for lowering bad cholesterol. And the safety note here tells you exactly what to look out for. Any kind of unexplained muscle pain. That's something you should always report. It also mentions that you might need some lab work done from time to time, just to track how you're doing.
Okay, so we've looked at a bunch of specific medicines, but what are the big rules that apply to pretty much any medicine you take? This last section boils it all down into 5 universal rules for staying safe.
Think of this as your go-to safety checklist. Number 1, always confirm the diagnosis is right in the first place. 2, check for any conflicts with allergies or other meds you're on. 3, if it's a possibility, you have to ask about pregnancy and breastfeeding safety. 4, follow the instructions on timing to the letter. And finally, number 5, know what the signs of a severe reaction are so you can get urgent help if you need it.
And that's a wrap. Our goal today wasn't to give you medical advice, but to give you the awareness to be a more active partner in your own healthcare. So I'm going to leave you with this one question to mull over. Now that you know a little more, what's one better, smarter question you're going to ask your clinician next time? Stay curious and stay safe.